Good afternoon, everyone. It is amazing pleasure to present to all of you my 4 months of practicum student. And before anything else, I would say it's amazing to just like look at all of you. Over the 3 years, I have know your names, but never has seen you. So it's amazing. um, so my presentation today will focus on the core theme of my practicum, which is public health knowledge translation, or known as KT. Um, I'm coming to you from Yellowknife, Northwest Territories. So first of all, I want to acknowledge that I'm situated on the traditional and homeland of Dene, Inuit, Métis, and Cree people of Northwest Territory. I'm deeply grateful to many Indigenous people of Northwest Territory for allowing me to learn, work, and live on their lands. Um, my practicum was placed with the National Collaborating Center for Environmental Health, established in 2005. It's one of the 6 national collaborating centers of public health in Canada. NCCEH mainly focus on environmental health, and the main focus of the organization is to use scientific information to strengthen public health practice, programs, and policy across Canada. I also would like to shout out to my current employer, Government of Northwest Territory, who supported me throughout the practicum and keep me employed. Okay, so the pictures you see on the screen and throughout the presentation are from 2023 wildfire in Northwest Territory, where more than 50% of the population ended up evacuating, and we had more than 100 days of extreme smoke exposure to about 60 to 70% people of Northwest Territory. So as a policymaker in my current role, this was something always in my mind about how to develop a policy, a program that can help people protect themselves from the smoke exposure. I ran into or basically walked into the practicum with that thought process, and NCCEH supported me. ASHRI, or American Society of Heating, Refrigeration, and Air Conditioning Engineers, is a standard making organization. Their standards are adopted into our building codes, and those are they are the technical expert and for HVAC technicians throughout the North America. They publish standards and they also publish guidelines. So in November 2024, they came out with Guideline 44, protecting building occupant from wildfire smoke exposure, smoke exposure during wildfire and prescribed burn events. Okay. So, Canadian Institute of Health Research defines knowledge translation as a dynamic and iterative process where interaction between researcher and user occurs to synthesize, disseminate, and apply knowledge to improve the public health service and systems. So, main deliverables for my practicum was to develop a public health companion guide to the ASHRI guidelines. The original guideline from ASHRI, as I said, are very much rooted in the rooted and directed for the engineering professionals and covers lots of technical information. The KT product would translate that information and support the frontline public health professionals and policymakers to implement the information. So going back to the definition, I am a user who is interested into the knowledge and which in this case is the detailed technical scientific documents, and synthesize that into a KT product to disseminate the knowledge across the board. I will get back to the application part at the end. So as far as the method that I implemented started from just reviewing the document and gaining my own knowledge about that. After that, the information was sorted into public health information and engineering or technical information. Once the public health information is identified, that was further sorted into a flow so that it helps the learning process. The next step, which is the most core of the knowledge translation work, is to actually identify the gaps in the knowledge and develop tools and resources to fill those gaps so it helps the decision makers to adopt those information. In my case, I ended up developing checklists, diagrams, tables, and other sort of information presentation so it can be useful in the long run. And then the whole information is put into a product or document. In this particular case, revise, refine, go on. For the next few slides, I will go on the key information related to the KT product. Um, so, wildfire smoke is a mixture of organic and inorganic gases and particulate matters. The composition of the smoke and its impact on the human health is an active area of research. For the most part, particulate matter 2.5, so that's the particulates which are smaller than 2.5 micrometers in diameter, are usually used as a proxy to study smoke and its impact on health. The short-term impact of smoke is very well known, but the long-term impacts are still under study. So when you focus on PM 2.5, the first thing you have to understand is there are no safe levels of exposure for PM 2.5. In most of the developed world, the ambient air quality or ambient air levels of PM 2.5 are less than 25 microgram per meter cube for urban areas and less than 10 for the rural areas. The other important knowledge is that infiltration coefficient. So what that is a proportion of the outside pollutants that filter into the building through envelope and through the ventilation system. It's basically is never found less than 20%. So even with the most advanced building, the infiltration can be never less than 20%. Moreover, there are indoor source of PM 2.5. So cooking, cleaning, just a regular life can also be a source of PM 2.5. And for the advanced world, the Western world, most of the people spend about 90% of the time indoors. So think of your home, your offices, service sector, everything is spent indoor. So what it leads to is understanding that because there's no lower level of PM 2.5, your goal should be is to achieve LRA or as low as reasonably achievable targets. So how do a building achieve LRA for smoke? There are four main principles for it. So the first one is improve the building tightness so that the smoke is not infiltrated into the building. Second, filter the air which is already inside the building to improve its quality. Then maintain a positive pressure so that the smoke and air is pushing outside the building and not coming in. And then last one is monitor the whole building so that it still remains safe for people to live in. All those principles coming together, that is a smoke readiness plan. So, sorry. So there are four parts to the smoke readiness plan: planning and documentation, building preparation, implementation, operation monitoring, and return to the normal. The KT product itself goes into much greater detail about each of the parts and then provides a simple to use checklist for each of the part. There are a number of other concepts throughout the KT product to help decision makers learn what targets they want to achieve and how to achieve those ones. Unfortunately, I cannot go into the 10-minute presentation for all those, but things that I do want to bring to all of your attention is there are the KT work divided each of those four parts into further four parts, and those are terms factor. So how the document is organized is that it gives each of the information into factors. So design factors are your building designs, envelope fixed structures, engineering factors is your mechanical system, your HVAC system, your sensors and all those. Administrative factor is your human resources, the people who are operating the building. And then last one is individual factors who are individual, which are in control of their individual space. So if you have done occupational health and safety training, you can see there's a hierarchical approach to all those factors. What I want to provide information is that smoke readiness plan is a living process. It allows you and the decision makers to identify factors that can be modified within their buildings and improve those ones to have better air quality during the smoke events. Also, it's a circular process, so it has feedback mechanism built into this. So as smoke readiness plans are utilized more and more, they will improve just upon themselves. There are clear benefits to smoke readiness plans. It's a tool for the climate change adaptation because it's a multifactorial. There can be a proportionate response to it because it allows people to stay within their building. Obviously, there is a mental health benefit because staying in a known comfort place, and then because people can stay indoor longer, it can support a comprehensive emergency management. I do recognize that there are challenges with this tool. The biggest one is a very resource intensive. It requires upgrades, improvements to building, which are very financially expensive, as well as it requires people to manage those, so human resources. And also it doesn't there's a equality and equity challenge is that because it's related to building, people who are low income workers who has to work outside, the benefit doesn't go to them. It usually follows people who are in the office spaces. I do want to end with the personal reflection on this one is that at the personal level, this was a very rewarding work. So, apart from learning new skills and core competency, knowing that this product will be communicated through NCCEH and it will be applied to and available to every public health professional across Canada and North America, it's a very fulfilling to know that. Now, going back to the application of KT, my office at the Government of Northwest Territory is trying to set up a cleaner, cooler air spaces for all 33 community, which would act as a climate change refuge. And this smoke readiness plan will help me and help us develop those spaces to achieve the best possible air quality. Thank you so much.